A warm welcome to all our PhysioTV viewers here today. We are yet again here with a very interesting topic. Our topic for today is biohacking cognitive fitness in the elderly. Our guest lecturer for today is Dr. Megha Sheth. Dr. Megha Sheth ma'am is a lecturer at the SBB College, Ahmedabad since last 18 years. She is also the guide for Masters and PhD program at the Gujarat University. She has done her graduation from Physiotherapy School at GSMC, KEM Hospital, and her Masters from SBB College, Ahmedabad. To talk about various achievements under her name, she is an author of a book titled Principles and Practice of Physical Rehabilitation and has 4 more books coming up by the end of April. She has also co-authored a book called named as Effect of Lifestyle Modifications and Exercise on Fatigue in Subjects with PPS. She has also written a chapter on disability in a community health book under the publication of JP. She has a very keen interest in geriatric health, fitness and research. She has presented various papers at national conferences, a poster at CSP UK 2014 and a paper at WCPT in 2021. She is the International Health Professional from India in Post-Polio Health International Post-Polio Directory, and she has conducted various seminars and lectures at national and international level. I would like to welcome Dr. Megha Sheth ma'am to start with her topic for today.
Thank you, Simran, for the introduction. And thank you, Sancheti College of Physiotherapy, for the opportunity to deliver this talk, which is close to my heart. As we all know that the aging population is definitely on the rise in all countries, whether it's the high-income countries or the low-income or the middle-income. With so many children from India also leaving for better prospects outside the country, the parents and the grandparents are here now. And from major joint families, we are now coming into the older people living alone. So these people have their own problems. When we talk to them, they're functional, they're moving around. But when they talk to us, they say that I am slowing. I cannot do 2 things at one time. I am unable to walk fast. So they have these problems which do not need treatment according to them, but they have these physiological changes which do worry them. So today my talk is on biohacking cognitive fitness, where we always look at physical fitness, the general health, the physical health, but we do miss out this brain, which is also an important part of our body. So if you look at cognitive fitness, it is the level of brain's alertness. It is a state of optimized ability to reason, remember, learn, plan, and adapt. So basically, the cognitive fitness makes it possible to live well, to live our lives the way we want to, because we can do what we want. There are various domains of cognition, which I'm not going to talk about, but you have complex attention, language, social cognition, and many more. So cognition by itself is very complex, but let's see how we can improve the cognitive fitness in the older people today. So we also hear dementia. A lot of people complain that I forget things. I don't remember the names so easily. I forgot to do this today. So dementia is marked by memory disorders, personality changes, and impaired reasoning. We also have 2 syndromes which come a little ahead before a person can actually be labeled as dementia or Alzheimer's or Parkinson's. So one of them is the motoric cognitive risk syndrome. This is characterized by a slowness of gait speed in presence of subjective cognitive complaints. So if we go to assess cognition, it is not affected per se. But yes, if you look at the domains of cognition, the patient or the person tells us that they have issues in the various domains. So they have subjective complaints, but they do not have dementia and do not have a mobility disability, but their gait speed is reduced. So when we have the presence of these 2, slowness of gait speed and subjective cognitive complaints, this is somewhere where we can actually start treating both the gait speed and cognition. So that is the motoric cognitive risk syndrome. And we also have the mild cognitive impairment, so which is the stage between normal aging and pathological dementia. So it's whenever someone tells us, yeah, I am forgetting things, I'm not able to remember, and we say, yes, that's normal, that's aging. But a little more than aging and a little less than dementia and Alzheimer's, we have the mild cognitive impairment. And we need to find our patients here so that we can strike early. We can get them back into their normal life early. So there are many different forms of aging. One is the normal aging process, chronological aging, biological, and pathological. Chronological aging is the same for everyone. As every year passes by, you grow a year older. Biological aging is also that happens in everyone. So that's the physiological changes that happen with aging. When these physiological changes are above a certain level, they become pathological. And that is when the person starts having impairments, activity limitations, and participation restriction. Now, what we want our patients to do or have is active aging or successful aging, productive aging, competent aging, and optimal aging. So these are all synonyms for the same, maybe healthy aging or active aging. So that is defined as a lifelong adaptation process where we are trying to maximize cognitive and mental functioning, positive mood. We want to have a sense of control with our patients. They should be taught active coping styles, and they should continue their social participation and engagement. So when this is all done together, the person can be said to have a healthy aging, optimum aging, or active aging. It is a multidimensional concept where we are embracing health, physical and cognitive fitness, among others. So it's not only the physical fitness that's important, but also cognitive fitness needs to be tackled. Aging is now considered from a positive perspective. So it's not bad to age, it's good to age. We have to start a new life, but along with our certain changes that take place. External circumstances are crucial to the aging process, but the individual himself or herself is also an agent for her own aging process. So yes, our aging is going to depend on certain external circumstances, how much of a physical load we had when we were young, but individual factors are also important, which we will be talking about a little later. Selection, optimization, and compensation are adaptive mechanisms that can be found within the aging process. Compensation is something that we do not actually need to teach the elders. It is the decline that takes place with cognition. The patient or the person is compensating by knowledge-based pragmatics. So the practicalities that happen in life, they know that they cannot do this, so then they switch over to this. We do not have to tell them that you have to compensate one domain with the other. You need to have a high motivation for compensation. That is, they should want to do something, or otherwise they'll be just sitting in the chair and become inactive. And technology can be used for compensation mechanisms. So like if we have memory issues, we can use reminders in our phone, which is the technology. As physiotherapists, we can help them in selection and optimization. So selection would be of the healthy lifestyles. We need to make them aware of the options that are available for healthy lifestyles, and we could help them in that selection. We could help them by optimization, by cognitive rehabilitation therapy, where we can tell them if they're getting tired, then if they're having fatigue, we can teach them the optimal ratio of work and rest. So we can teach them that optimal regimes for them. So active aging can get better by selection, optimization, and compensation. Neuroplasticity is a property of the central nervous system, and this does not end at any age. It continues till our very end into old age. So whenever we challenge our system, neuroplasticity is going to happen, and the newer pathways are always made. So when dementia happens because of closing of certain pathways, we can always use neuroplasticity to open newer ones. Three terminologies which are also important. Mental resilience, that means fighting back. It is the condition in which the brain continues to form new circuits and connections throughout its life. So the brain never stops. And this working of the brain indicates that it is healthy and is undergoing a process of recovery. So we always need to keep fighting back, do not stop. Mental flexibility helps with better memory, learning new sciences and reactions, and learning from new environments. So we should be learning till the very end. We should not ask the patient to stop anything at any time. If you forget something, start all over again. So even if you have language issues, you cannot remember alphabets, we can always start teaching A, B, C, D again, and that improves the mental flexibility. Cognitive reserve is something that we got with our education because of, and when people have been less educated, their cognitive reserve is less. Whenever the cognitive reserve is more, so it's like when we were small and we did weight-bearing activities, we increased our bone reserve. When we were young and we had challenged ourselves intellectually, our cognitive reserve increases. And that enhances the capacity to tolerate neuropathologies. So cognitive issues can be pathological, like Alzheimer's, dementia. We're not going much into that pathology, but we're talking more of the normal aging cognitive decline. So if you look at the potentially modifiable factors for dementia, the non-modifiable factor is definitely genetics, but modifiable factors are early life education, which was building our cognitive reserve, midlife hypertension, obesity, and hearing loss, late life smoking, depression, physical inactivity, and social isolation. So these are factors that can be modified. You can even have education at a later life. There is no age to limit the education. Because of COVID, social isolation had increased, and therefore the problems also did increase a bit. Now, if we look at biohacking, what is biohacking? It is the art and science of changing the environment around you and inside you so that one can have a full control over one's biology. Hacking of computers was getting control over the computer. So biohacking is getting control over your own body. This can be done by making small incremental diet changes or lifestyle changes. And this leads to small improvements in the health, well-being, and quality of life. So biohacking is certain attitudes and lifestyle choices, which also includes exercises. And these three can help to enhance cognitive fitness. So we have to hack our own bodies so that we can delay cognitive changes that can be harmful later. Or even if they have started, yes, it's never too late to get control over the body and to biohack the body. So if you look at cognitive reserve enhancing factors, if the cognitive reserve is more, the neuropathology is not going to be able to come in very easily. And here you have intellectual stimulation, where reading is an important thing. You have physical exercises and you have leisure activities. So these three changes in these three factors can help delay cognitive problems. Another thing that is important is positive affect, coping, and control. So the people who had more positivity were probably able to fight even COVID a little more, and that reduced the mortality of the older people who were positive, who were less afraid of COVID. Positivity also protects against functional and physical decline because that helps one to keep moving, and that avoids the person becoming frail. Negative effects such as anxiety then requires that the person goes in for some coping or management strategies, preferably from a psychologist or a psychiatrist. Positive coping skills in old age can be trained and promoted. So it's never too late to develop a positive attitude. And as physiotherapists, yes, we should encourage that positivity in patients and to try to remove negative effects like fear avoidance behavior and fear of falls, things like that. The sense of control influences the well-being and is a very good predictor of healthy and active aging. So when the person knows that, yes, I am in control of myself, I am able to make decisions, I can decide what I want to do in today, then the person is a little better off. Sense of control can be trained. And self-efficacy is perhaps one of the best well-known constructs in successful aging literature. So self-confidence is going to be important. And here we may have the need for a multidisciplinary team besides physiotherapy. So that would include the geriatrician, psychiatrist, and psychologist. Social functioning and participation has been associated with the association between social relationships and the prevalence and incidence of and recovery from disability has been well established. And that is why probably there were people visiting in hospitals and visiting when you are not well, so that you probably get better faster. More socially active persons report lower levels of disability than their less active counterparts, as it improves cognitive function. And thankfully, even during COVID, the people who could use the mobiles and WhatsApp videos to interact, it definitely helped us move through the lockdown of COVID. So if you look at the first cognitive reserve enhancing factor, it's the physical exercise and behavioral lifestyles. So elders, physical exercise reduces mortality risk. Elders with healthy behavioral lifestyles show 4 times less disability than the people who smoke, drink too much, do not exercise, and are obese. Mediterranean diet is strongly related to survival and life expectancy. Also, diet and eating well and not losing weight is going to help prevent frailty. The other thing that can be done is cognitive activity and training. Frequent cognitive activity can reduce the rate of cognitive decline and is also a protective factor against dementia. Effective cognitive trainings and intervention can optimize cognitive function, compensate the intellectual losses and declines, and therefore it enhances the cognitive reserve factors. Now, to do this cognitive training, one can look at a lot of things. A lot of mobile apps are also available now to improve cognition. So these are pictures of some cognitive games that can be used. Besides that, one can work on jigsaw puzzles, jigsaw cards. One can learn a new language. One can build up the vocabulary. So every word, when you are reading the newspaper, the person can be told to pick up a new word every day and to understand the meaning of that new word. Listening to music, dancing is also enhances the cognitive reserve. Learning new skills, teaching new skills. So if you think that you already know enough as an older person, we can always teach whatever we know. And working on the psychological aspects by meditation, Tai Chi, and yoga, they also enhance cognition. So eat for brain health, like I just said, a Mediterranean diet, and sleep is as important as physical exercise. So yoga for brain power can be done. Yoga needs, I think, no description because it is one of the best available modalities. Neurobics is a science of brain exercises. So this was devised by Dr. Lawrence Katz and Dr. Manning Rubin. And they are simple exercises that use the 5 senses that we have. That includes touch, sound, taste, smell, and sight. So it is using these senses together with emotions. So do I like something? Do I want to do something which I see, hear, or whatever? And it also emphasizes the importance of socializing as a major part of brain maintenance. So yes, you have to use the 5 senses, but you also have to have the emotions attached and you have to have social interaction. That can help to prevent cognitive decline. Now, this neurobics challenges the memory, attention, logic, which are domains of cognition, as well as the verbal skills, and encourages one to disrupt their everyday routine. Most of us are very happy doing the same thing at the same time. So it's 8 o'clock, it's breakfast time, 9 o'clock we leave for work, 5 o'clock we return back home, do our routine and go to sleep at a fixed time. So what Neurobics actually says is, do not do something in a fixed routine, keep challenging or keep changing your daily routine. By doing so, the brain reignites new pathways and connections that were underused, and this strengthens the nerve connections and the receiver, so the pathways. So it's making new pathways because you're doing something new every day. It's not a fixed pathway that you have to use. And this results in a more elastic and fit mind, which helps in memory and becoming a more creative and balanced individual. So you have to, it challenges the memory and makes up new pathways. What are the exercises that can be used as neurobic exercises? The first one that's described is switching hands. So if you are a right hand dominant person, you need to start using the left hand for whatever activities that are possible. Maybe you can start eating with your, using the spoon with the left hand, with your non-dominant hand. Start writing a little bit, start drawing, making circles, making figures with your non-dominant hand. So that starts making new pathways on the other side of your brain. You can start working with eyes closed. So it's just like simple activities which are not dangerous. So you could just stand and have a bath with your eyes closed. You could walk in your room, which you are comfortable with, which you are aware about, with your eyes closed. So that is one thing. So you are blocking vision so that there's feedback from the feet. Do things upside down. This can be as simple as just wearing the watch on your hand upside down and reading it. And then going up to the mobile. You can use your mobile upside down. And it is actually very interesting to do that. So, and that builds new pathways. Language is a domain of cognition, but reading, listening, and speaking, they all have different areas in the brain for each of these functions. So you want to know something, you can read it from the newspaper, you can listen to it on the radio or the television, and you can give that news to someone. So all three are different, they have different areas of the brain and they're going to make new pathways. You can simultaneously use all your senses. The example that again is given by them is going to the market. So when you want to buy vegetables or fruits, you're going to see them, you can smell them, you can take them in your hand. You're talking to the vendor, so you have language. So, yeah, you're listening to the person also whom you're going to talk to. So simultaneously, you will be using all the senses, and you also have the emotional aspect where you decide what to buy, what is the cost. So you have some calculations going on. So this is in contrast to sitting at home and buying something on your mobile, where you're only going to look at something on the screen and decide to buy it. The same thing happens when you go to a restaurant or when you are sitting to eat. You look at the food, you smell the food, you touch the food, you see the food, and that is using all the senses together. The important thing is keep challenging yourself and do hard things or do the simple things the hard way. If you want to do hard things, yes, that's open. But otherwise, simple things like even calling up someone. Try to remember one mobile number in a day and dial that number as a challenge every day. Because of these phone memories, we have we've stopped remembering a lot of things. So the older people can actually remember numbers because they don't know how to save the numbers on their phone or don't know how to retry them. So they keep dialing the numbers. Socializing, like I already described, is important. And it's never too late to develop hobbies. So we've always seen photographs of the grandmothers knitting. So you can develop any hobby that you haven't done till now. There's painting that can be started after retirement, camping, traveling. Depending on your health condition, you can develop some new hobbies. So you can do any of these, and that's going to help improve cognitive fitness. Physical exercise actually does not need any proof that it's going to be beneficial because it is the thing to improve the thing that improves cognitive capacity in the brain. Exercise is beneficial for the brain in many ways. Regular exercise habits can prevent many ailments, including Alzheimer's. It's beneficial for the development, ability, and flexibility of the brain. Studies have shown that exercise in any form is the best exercise for the brain. So you could either encourage moderate or low intensity continuous workouts, or you could do high intensity interval training. Anything that is done, even a 10-minute walk is the best exercise for the brain. And exercise, how does it work? It enhances the release of nerve growth factors that help the brain cells function properly. Nerve growth factors probably also build up new brain cells, which is giving the brain an extra cushion against whatever is lost because of aging. So we're still building up new cells compared to what we are losing. Exercise can strengthen the brain's anatomy, neural networks, and cognitive abilities, and prevents functions like memory from deteriorating as one ages. So exercise, there is no other say that it is the best. Exercise also enhances blood flow to the brain, which can help keep it healthy and nourished. Exercise also prevents hypertension and diabetes, which were the two risk factors for dementia. So hypertension and diabetes is also controlled, and that way also we are preventing dementia. Recent neuroscientific research shows that the health of the brain isn't, as experts once thought, just the product of your childhood experiences and genetics. So initially it was that whatever we are at a certain age is what we did in our childhood. But now it is said that what we are today is also reflecting what we did in our adulthood. So if I start exercising even at the age of 35 or 40, it's never too late. Whatever were my experiences in childhood can also change or better my older age. Right? So it's not only what you did in your childhood, though that is the best, because education and sports activities enhancing your bone capacity, that's always best in your childhood. But yes, it's never too late. So physical or mental workouts are the key, and brain imaging studies indicate that acquiring expertise in any activity is expanding the neural systems and makes them more communicative. So whatever you do at any time, you're still improving or changing your brain. This is one of the studies done by my PhD scholar Dhara Sharma, where she was working on lumosity and aerobic exercises to improve cognition. So she had done this so her conclusion was mobile application-based cognitive training is more effective in improving cognition in older adults with mild cognitive impairments. But the study also showed that aerobic exercise is equally good in improving aerobic capacity and quality of life. So even cognitive training actually improves the aerobic capacity. It's probably that when one can think better, you move around a little more. So that also improves your aerobic capacity. So whether you do cognitive training or you do aerobic exercises, quality of life is definitely going to get better. So to conclude, healthy lifestyle behaviors can benefit people of all ages, but to have the greatest impact on late life mental function, get started early. So midlife is probably a better time to start enhancing your cognitive reserve. Focusing on brain health is one of the best things to improve concentration, focus, memory, and mental agility, no matter what the age. So even if you did not do it in the middle age, you can still start as an older person, start learning all over again, start remembering all over again. By incorporating physical or mental exercise into everyday life, the mind is challenged and cognitive skills can be sharpened. So keep up the challenges and live like life is never going to end. I'm sorry for that. Live like life is never going to end. So we have to have a tomorrow where we are independent and we do not need to depend on anyone functionally. All the best, and thank you once again, Sancheti College of Physiotherapy.
Thank you so much, ma'am. It was truly an amazing topic and a very interesting talk. Considering I am a community physiotherapy resident, I can surely assure you that I'm definitely going to take notes from this talk and use them in my practice. To continue with the Q&A session, ma'am, I would like to ask you a couple of questions. Primary being, for people elderly, considering the most of the population, elderly population stays in rural area in India, what would you recommend should be our plan of action as a physiotherapist to improve their cognitive fitness? Since they are not very aware about cognitive fitness being important, and physiotherapy, exercising as a part that can improve their fitness overall and even as cognition improvement.
Yes, so the first step in actually overcoming any problem is to recognize that the problem exists. We may not need to actually screen someone. We can just assume that cognitive decline is going to happen. So we assume that it's there and it needs to be treated. I already described n number of ways which goes from a low income option to the high income option. So you have your mobile apps which are helping to improve cognition, but we have small behavioral lifestyle changes which can also help. So you can use the right hand or the left hand. You can talk more. You can meet more. So rural population probably has that option of meeting more and talking. So that social interaction is very important for them, and they should not stop. So going to the temple is something that should be encouraged. And yes, we need to encourage the physical activity. So if they can incorporate it, if they can understand the importance of that, both for physical health and mental health. They probably have an answer that we have been doing it all our lives, but working is different from exercise. And that's something that they should continue. They may have pain, which could be a problem, uh, but that should also be taken care of.
Okay. Thank you so much, ma'am. You made the concept really clear for me. I have one more question. You spoke about starting biohacking and exercising in the midlife to prevent the progress of deterioration of cognitive fitness in elderly. I would like to ask when in midlife do you recommend and how and when should we start advocating about cognitive fitness being really important and can be the process can be slowed down in elderly. So when is the right time to be the advocate of it?
I don't think I've read anything like this, but if I correlate it to physical health, the concept is that yes, as we are growing till adolescence, or yeah, till we just before adulthood, we are enhancing all our reserves, whether it's the bone reserve or the cognitive reserve. It's all going to increase, and once you are an adult, that stops, and you are going to start the decline. So the best time to improve your cognitive fitness or work on it is the same time that you want to work on your physical fitness. And we should not treat the two of them actually separately, but we should be aware about it that yes, our cognitive, we take it very lightly that, oh, I cannot remember names, I cannot remember numbers, I forgot my meeting today, I forgot to do the shopping today. So these are small signs that yes, something is going wrong somewhere. And probably before that also happens, we can get in, or signs like these. Memory is the first one that comes in. So signs of memory fading away is the time that yes, you need to be aware about cognitive fitness. And using technology, it's a two-edged sword. Technology is the cause for our cognitive decline, and we can use technology to improve our cognition. So we need to draw that line that yes, sitting with our mobiles in our hand, are we deteriorating our quality of life or are we improving it? So
Okay.
I hope that answered your question.
Yeah, it did answer my question. Thank you so much.
I would like to thank Dr. Megha Sheth ma'am for delivering such an amazing talk today. It was truly amazing, ma'am. Thank you for taking out time from your busy schedule and delivering such an interesting talk. I would also like to thank Dr. Parag Sancheti, Chairperson, Sancheti Group. I would also like to thank Mrs. Manisha Sangvi, Executive Director, Sancheti Group. I would like to thank Dr. Apurva Shilpi Sir, Principal, Sancheti College of Physiotherapy, and Dr. Sona ma'am for coordinating this talk today. I would also like to thank our tech support, Dr. Tushar, and our lovely audience today for attending the session. Please stay tuned for more.